Dr. Lang, do you have a cure for fibromyalgia?
That's amazing that you asked, because that's one of my pet peeves. First of all, I want to say this, and I'll say it publicly. There is no such thing as fibromyalgia. It is defined in hundreds of different ways, depending on. But let's say a common presentation of a certain type of an autoimmune disease, where you feel achy, sometimes even a little fever. You feel like you almost have a flu, and your muscles are stiff and you're tired. Sometimes that's called fibromyalgia. It could mean 100 different things. It's really a set of symptoms. So it's like, what is your diagnosis, doctor? Well, if you have a headache. I mean, so you can't just dismiss a patient, say that they have fibromyalgia, and here's something to cover it up. If there is such a thing as fibromyalgia, which there really isn't because it's used too vaguely, let's look at some of the causes of quote-unquote fibromyalgia. Feeling of being uncomfortable with your musculoskeletal in general, nothing specific, it moves around. Very often people are suffering chronic fatigue syndrome, which is another hackneyed use of a word, it could mean anything too. But they have two autoimmune diseases, Coxsackie and Epstein-Barr, one of two, and they're sort of cousins to each other. When you take my course, you'll realize it when you start doing this technique. And what happens is you fall apart. It's like Hans Salyer in the 50s. Your adrenals get shot and you start falling in on yourself. And because of that, you can get achy in any part of your body, chronic fatigue, exhaustion, and you can fix that in one visit. Sometimes it takes about a month of the person sort of recuperating, staying off, sweets and high carb diets, staying away from that stuff. And it's an amazing thing. An amazing thing. Within 30 days, 90% of the patients are completely over it. And it's a hump for the rest of their lives otherwise. They take pain to mask it. And they even compensate some good things. They'll go to the gym every day and this and that. But they'll be much better in one visit if you learn these principles and how to do it.
Thank you.